Okay, so I'm Morgan Currie. I'm a senior lecturer in science, technology, and innovation studies at the University of Edinburgh.
And I'm Lena Podoletz, a research fellow also at the University of Edinburgh.
Okay, so in this presentation, we summarize our paper on emotions and digital assemblages. And we argue that qualitative longitudinal research provides an invaluable tool in studying automated decision-making systems. And in particular here, it gives us insight into the lived experiences of users of automated systems. So first we will give a brief introduction of our study of an automated social security entitlement system in the United Kingdom called Universal Credit. Then we will describe our methodology and lastly some of our key findings. So Universal Credit is the largest social security payment in the UK. Recipients apply for Universal Credit online and use an online account to communicate with staff and manage their cases. Universal Credit is also a means-tested and conditional benefit, so some recipients are required to work or actively look for work in order to qualify. But for our purposes in this talk, an important property of Universal Credit is that it features an automated payment algorithm that determines the amount of money a claimant receives each month. So the payment calculation goes as follows. Claimants start with a base level payment amount based on personal circumstances. Then for working claimants, this amount is adjusted depending on earnings over the month prior. The adjustment for earnings are based on data through a data exchange with the real-time information or RTI system of HMRC, and this is the UK's tax authority. So to summarize this, the more a claimant earns in the month prior, the less money they will receive in their next Universal Credit payment. So the data that we present in our paper comes from an ongoing qualitative longitudinal study started in 2022. Qualitative research provides insight on the experiential aspects of life. Qualitative longitudinal research focuses on tracking participants in real time and tracing changes over time. It provides an opportunity to explore the effects of these changes together with the participants. It's also ideal for facilitating trust with participants and for letting them communicate their situation as they see best. This method also allows the researchers to iterate data collection by follow-up questions and to change the research design. Qualitative longitudinal research is therefore very useful for studying automated decision-making systems like Universal Credit because it can respond to the dynamic nature of these systems as they impact users' lives. This method can also generate near real-time data when memories and emotions related to these automated decisions and changes are fresh. So we recruited 26 participants through local charities to take part in the study for 6 or 12 months, depending on the complexity of their cases. The study applies two methods for generating data with each participant. The first is semi-structured interviews, and the second are bi-weekly prompted updates through phone texts asking about participants' interaction with Universal Credit. And overall, we gathered relevant data from 21 participants.
Now we will share a brief summary of our findings. And in our paper, we focused on two issues of Universal Credit's automated system. Firstly, the real-time information system of HMRC, and secondly, the Universal Credit monthly assessment period. However, to be able to showcase the depth of information we were able to gather, in our talk we focus on only one of these issues, the real-time information or RTI system, and highlight the stories of two participants. The real-time information system, as we mentioned before, collects data for tax purposes and shares it with Universal Credit daily through the RTI system. This is then used to adjust each claimant's monthly payment. RTI errors are endemic to the system due to misreported or belatedly reported earnings by employers. Our participants shared their experiences with these errors. The first story we're going to describe is Gaya's. She is a white Polish woman in her late 40s raising two children. In her first interview in June 2022, she described her case as relatively simple, saying Universal Credit works well for her. However, in October 2022, Gaia reported to us over text that she had received more payment from Universal Credit than anticipated and assumed her employer had not reported her earnings to HMRC, resulting in larger than usual Universal Credit entitlement. She wrote to us, "Something was not reported to HMRC and I told them, Universal Credit, that my award is too high." Gaia then pursued the matter with Universal Credit, but in November, it still had not rectified the mistake. When we interviewed Gaia a second time in January, she told us that HMRC had finally reported the September earnings 2 months later in December, and the overpayment from Universal Credit would now be deducted automatically from her future Universal Credit payments. Her employer told Gaia they had reported the earnings on time, so she never received an explanation for the delay. Gaia shared that she did not feel she could affect or speed up the process. Despite this, she told us that she was happy with how the situation was rectified. The second story is Emily's, who identifies as Black, Caribbean and white, and she is a single mother of 2 children in her late 30s. In her first interview, she was very unhappy with Universal Credit. She had never felt supported and had received conflicting and wrong information on her case from caseworkers. Emily shared over a text that her employer made an error reporting her salary in November 2022, and as a result she received £300 less in her Universal Credit payment than she was entitled to. Emily wrote, "I know the whole system is an absolute shambles. They are causing more hardship. It's a horrible situation." At the end of December, she wrote to her case manager, "There's surely another way to rectify this, so that I'm not in financial crisis again. This is now adding to my mental health as I'm not sleeping worrying." By mid-January, Emily was really distraught. She texted us, "So I'm currently waiting for that dispute to be resolved as I am once again out of pocket and struggling because of an error." When we checked in at the end of January, Emily happily let us know that the error has been fixed thanks to her employer's swift response. Despite this, Emily experienced difficulties during this period of uncertainty, which lasted for 2 months, writing, "It's just frustrating that I had to get an advance on my wage."
Okay, so we conclude our presentation by highlighting 2 particular advantages that qualitative longitudinal research can bring to the study of automated decision-making systems. First, our longitudinal approach provides insight on the dynamic nature of automated decision-making systems. So for instance, we could trace how volatile Universal Credit's automated payment algorithm is. So claimants such as Gaia, who had otherwise no trouble from the Universal Credit payment at the beginning of the study, encountered problems after the study started. Through screenshots shared with us, we could also get a view of how users interact with Universal Credit staff to resolve errors, and we could discuss with participants their reflections on these encounters. So this method gave us insight into problems as well around Universal Credit's accountability. So this method allowed us to establish very granular timelines for RTI error resolution that could have been difficult for participants to recount from memory.
Secondly, we were able to gather data as users reacted in near real time and in situ to ADM systems, capturing the emotional dimensions of users' interactions. Participants expressed a range of emotions towards Universal Credit, from frustration and desperation to gratitude and relief. Participants expressed real fears of material scarcity affecting their children at times. Our study traced these trajectories of emotions as participants first reacted with confusion and annoyance at a Universal Credit error, then relief if the issue is resolved, or resignation, anger, and helplessness if they could pursue the matter no further. We argue that more work is needed to capture the lived experiences of users, including their emotional reactions as they react with ADMs.